Good morning. Welcome to the webinar. My name is Kathy Lydahl. I'm a community engagement specialist in Southeast Minnesota for the Mayo Clinic Health System. We are happy to partner with Thorncrest Senior Living Community to bring you today's program. On behalf of Mayo Clinic Health System and Thorncrest, welcome to today's event. The program will be recorded and available to view at a later date. Today's speaker, Anita Bissinger, will share information on how to maintain social distance without increasing risks of social isolation, and then she will take your questions. So feel free to submit your questions by using the Q&A tab at the bottom of your screen. You will be able to submit your questions anytime during the event. Before Anita's presentation, Catherine Bluboltz, Sales and Marketing Director at Thorncrest Senior Living Community, will say a few words on behalf of the senior communities.
Thanks so much, Kathy. On behalf of Thorncrest Senior Living and the other area senior living communities, we want to thank Mayo Clinic Health System for partnering with us to provide this ongoing Health Talk series with professionals from Mayo Clinic who have talked on a number of relevant topics that affect our seniors. They quickly adapted to the virtual format so that we could continue bringing the insightful health talks to the community members, and we want to thank you for that. Now, I'm pleased to present our speaker, Anita Bissinger. Anita is a licensed clinical social worker at Mayo Clinic Health System in Albert Lea. She provides psychotherapy and assistance to connect people with local resources. Anita has been with the Integrated Behavioral Program at Mayo Clinic for 3 years, with 13 years of experience as a social worker, providing cognitive behavioral therapy for individuals with various mental health concerns. So we'll turn it over to you, Anita.
Thank you very much. I am going to quickly just share my screen. Make sure that everybody can see it.
Looks great.
Thank you. So I just want to kind of start off with talking a little bit about the difference between social isolation, social distancing, and loneliness. As I went through this process, it was very interesting to discover that prior to COVID-19 occurring, individuals who were 60 years and over had a 50% chance of experiencing social isolation, and approximately a third of that group had loneliness involved. And the concern with social isolation is that it is comparable to smoking, obesity, lack of exercise, high blood pressure, as far as how it can impact our health. Many people who are lonely or socially isolated will experience increased falls, more emergency room visits, longer hospitalization stays, longer time departing from the hospital because of poor supports at home, less infection resistance, cognitive decline, sleep quality is impacted, an increase in mental health concerns such as depression, anxiety, and dementia. Researchers have found that people with a weak social interaction are 50% more likely to die prematurely. So it is a very significant health risk that we want to be mindful of. When we look at this process, we want to first start with knowing, well, what is connection? What does that mean? And it is something that is typically meaningful with us between people. It's having common ground, having the same interests. A lot of it is just knowing that you're being seen by the other person. And often when we don't have connections, we start struggling. And the reason that we start struggling is because connection is so hardwired into what we do and who we are. As human beings, we are the one animal on the earth that shares our thoughts with each other, that shares our ideas, that shares our joys, that shares our sorrows. That is part of who we are. And that's because we learned early on when we were out there hunting and gathering that working together made a big impact on survival. Strength in numbers really means that there is strength in numbers. and the community was then able to divide the labor so it was more feasible for everybody in regards to keeping and maintaining food and shelter. When an individual is not part of a group, it's very common to see that anxiety increases, a feeling of being shunned, feeling of all of these types of things can occur for somebody. So it's really important that we do have these meaningful connections. When we look at this, not only is it hardwired, but we also then have many chemicals in the brain which respond to us being connected with people. Our oxytocin level is a defense mechanism that will change when you're not part of a group, but your fear and stress will increase. Endorphins are released naturally when we touch with each other or move together physically. If you are somebody who enjoys dancing, the endorphins are one of the reasons why you enjoy it, because of that movement together. The dopamine part of our brain is very much, it's a strong reward part, and it's a powerful motivator for us to seek companionship. When we're not connected, we have lost that protection of our group, part of our community, and so we do become more anxious and hypervigilant. You will notice that everybody notices that when you're in a crowd of strangers, you will notice that you're much more aware, that you are watching the people around you because you don't have a safety net. Now, that's life-saving in many ways. It has been throughout our development as a humankind, but it also can be very draining on our physical symptoms if we're always on high alert. So not everybody connects in the same way, though, because of personality differences. We connect differently. Um, an individual who during this quarantine time and was an extrovert may have found themselves, as this individual is, basically clamoring out the door of get me out of here, whereas the introvert took this time to maybe reconnect with themselves in a different way, be creative, those kind of things. But what's interesting is that we feel pressures from both sides of that personality base. An extrovert may not always take that time to kind of step back and look within themselves and do that process, where an introvert, because society often says the extrovert is who and how we're supposed to act and be, can feel somewhat judged if they aren't as outgoing. But the main thing to remember from this is that for an extrovert, they're getting their energy by being involved with large groups, where an introvert is getting energy from being by themselves or with just one or two people. So what is loneliness? When we look at loneliness itself, it is basically, again, that loss of connection. But there are different types of loneliness, just as there are different types of connection. The intermittent or emotional loneliness is when we long for that connection to the other. The relational or societal loneliness is for a desire for close friendships. Collective loneliness is when sometimes as a community we may not have a central drive. There is a difference, though, between perceived loneliness and objective loneliness or isolation. When we look at our society today, many of us have what we can call an objective loneliness, simply because what's happened is we are not in contact with our groups in the same way that we have been. A perceived loneliness is when an individual can be lonely even when they're amongst friends or caregivers or family. It is a state of being, and it has more to do. It's usually something that we need to look more at. How can we improve some social skills? Maybe we need to be looking at some other mental health concerns like depression or anxiety that might be impacting that feeling of belonging and increasing that perceived loneliness. So the risk factors we have for isolation are many and have increased naturally over the COVID process. And I think if we look at them, many of them make sense. We know that living alone is a state of isolation, but sometimes that happens because of life changes, whether someone has died, friends become snowbirds, um, or we lose some of our health, or we become whoopsie, sorry. Or we become caregivers. Living in a rural area can sometimes impact our ability to be with other people because of lack of transportation or even just the amount of groups that are available to us. Um, Other risk factors can be mental health, our separation from the typical from other groups because we are experiencing racial or ethnic differences, social and sexual gender identification differences. Um, and also too, one of the things that we don't may not always think about is that though we have a longer life expectancy, it doesn't mean we always have a longer health expectancy. And so we are living longer, but maybe not always in the way that lets us live the life we'd like to. So with COVID-19, we have had an experience where we are no longer functioning in the groups like we did before. We are definitely away and apart from others in a way that we have not been before. When we look at that social isolation is when we cannot be part of those groups at all. Social distancing means that we're going to need to be a little bit more creative about how we belong to a group and how that group is part of our life. One of the things that we want to look at then, and one of the things that has developed for us as maybe even possibly a benefit from COVID-19 is solitude. Solitude is one of those things that we have been losing without maybe being aware that we have lost it. Dr. Emmett Sood and other researchers and individuals, even within and outside of Mayo community, have noticed that solitude is that part and process of being at peace with yourself. Think about all the times in which we used to have solitude before. Sitting at a restaurant, waiting for a friend to come, waiting for um, a child to leave the school and jump into the car for the ride home, um, having walks. Nowadays, we have multiple ways in which our solitude is interrupted, and I will take one big hit towards the cell phone in the fact that a lot of times, rather than being and sitting there in those places, we open up a cell phone and we become engaged in different ways. What's really nice about taking some moment for some solitude is it actually will be something that we will find to help to reduce that feeling of loneliness, because what happens is we get a chance and an opportunity to get to know ourselves for who we are through the process of reflecting, asking ourselves questions, doing multiple pursuits such as meditation, creative work, just enjoying nature. It's a time where we can have a moment to be. And I liked to look at this as a time in which we can befriend ourselves rather than always on the go. And I think that's one of the gifts, if we can say, through this process that has allowed us to maybe slow down a little bit. When we look at what kind of interactions we had prior to COVID-19, a lot of times our interactions had many different forms. Like I'm going to run to the bank, I'm going to talk to my doctor, I'm going to be connect with my best friend via phone, talk with them. And looking at that is a way that we were then connected together. With COVID-19, though, we have lost a lot of those processes because some of the ways in which we connected with people just aren't operating in the same way. senior centers, local support groups, rather than being in person, are now online. Worship gatherings are online. Traveling, visiting with friends, family shopping. All of these things I know you're all very familiar with, and you have felt this impact throughout your lifetime with these changes that have occurred. And so basically then it's like, now what? How do we do this now? What is going to be our new normal? How can we start to find ways to be active within the social distancing? So we're reducing the social isolation and increasing our time with others. A lot of it has to do with how we look at ourselves and how we're looking at ourselves within a community. What is connecting now? What does that mean? I don't know about you, but I know I have had multiple times when people have offered to help me, to provide help. You know, we all have done this where maybe there's a death or there's a party or there's a, there's any event that's coming up in someone's life, but we aren't always great about accepting that help. Some of that comes because it can be difficult to show our vulnerability to the need of being helped, maybe even a fear of, well, they won't think I'm as, that they'll judge me, this might happen, and that gets in the way of us connecting. But I want you to think about that. When you have offered help to somebody, if they had taken you up on it, would you have immediately told them no? Really unlikely. So oftentimes what I want us to do is when that help is offered, take it. Practice the acceptance of that, because that's going to help us with some of these next steps, which is where we start connecting. And when we look at some key strategies to connecting, we want to start with just that aspect of time. When we look at who we connect with and how we connect with people, 15 minutes a day, whether you talk to your husband, your spouse, your friend, your neighbor, um, a phone call, a shout across the street. Um, in our neighborhood, it's not uncommon for us to yell back and forth across the street, "How you doing? What's going on with the grandkids?" All of those fun things like that. Um, our video chatting can be a nice way to have a alternative face-to-face experience within this process as well too. So when we look at this process, not only that, do we want to, besides the time we're spending with individuals, besides that moment, we want to make sure that we also have focus. There is a lot of research out there that says we are not good at multitasking. I don't care who you talk to who says you are. I can pull up a lot of different research which says we're just not. Our brains don't do two things at once. What they do is they switch quickly from one activity to the other, and never then really having a chance to focus in on the one key point. And when we're working on doing connections, that's what our key point is. How are we connecting with this individual? How will we do it? We'll do it by turning off the TV, putting down the phone, basically giving that gift of time to somebody. Solitude. Once again, I'm bringing this up as a way for us to strengthen our social connections with people. I know it sounds like an oxymoron, but it is so true. The more we know about ourselves, the more we are going to be able to give to others. And the last one is service, because that kind of gets us out of our own space and helps us to kind of discover how we're important beyond ourself. And we can be connected to people in such a way that it reminds us of how valued we are as an individual. Now, when we look at this process, when we look at connecting with people, we connect with people in a variety of different ways. We have a number of different circles of influence, as you might want to say. So our intimate, close friends, the people with whom we have our deepest bonds and our most affection, and the ones we trust the most, takes typically of our connection time, 60% of our time. And that's usually a pretty small group, rarely more than 5 people. So that's our intimate circle. And then if we look at beyond that into our relational circle, whether that's our friends, our neighbors, people we grew to know and in school, often that relational group, it's because we have shared interests. We are enjoying being maybe part of the neighborhood with them. And then our next circle of influence or our next circle of people is collective. Acquaintances at work, worship experiences, organizations online. These are all part of that process. Now, we have a number of different ways in which we can be connected with individuals. And those ways often are thought of as Facebook, Twitter, Instagram, those very social media type of activities. Unfortunately, it's only been shown that they reduce the feeling of social isolation for up to 6 months. After that, rather than decreasing the isolation, it starts to feel worse. It feels like you're more and more separated from everybody else. And so what we want to do is start building ways where we're not engaged on just a platform, but with each other. So how do we do that? Well, part of this can be just by looking at starting being creative in how we think about engagement. There are a number of different things that we can do to create new experiences. Some of these are going to have to wait until after COVID-19. Some of them can occur now. I present the Men's Shed group as movement as one of the ones that will probably need to wait a little bit depending on your community. There are some, though, that are in this area, and it's basically what it is because men experience social isolation differently than women, simply because of societal expectations of how are to express their emotions and their feelings. They found that men do much better in reducing their isolation if they're doing something. So that's what this group is. It's a group of guys who get together in a shed and they build stuff, and they learn more skills about things. There are other groups which other ways to become engaged that we can do now. The Foundation for the Art of Healing is something that's working together with the AARP organization on helping people to become part of a group now. And they use mindfulness, they use art, they do a lot of really interesting things, and they call them art circles. Then, of course, we also have ways in which we can be active with others through community supports. There are agencies in different areas that will come and meet with you. Besides that process, there's also where you could do art or theater together online. For example, one of the things that my son and I will do is we will do a video chat. We don't care if either one of us are talking, but we just have the video chat open while we're working on projects. And every once in a while, we might say something and he might say something, and it's just a part of the process of finding new ways to connect so that we can reduce that isolation. Maybe you have a phone pal that you can talk to, somebody that you can say, hey, let's go to the Metropolitan of Art page or the Metropolitan Opera page and listen to some of their music or look at some of their art, or go to the unweaving.org page and look at this beautiful yellow weaving and what this means and to the people who went through this trauma. There's all sorts of ways that we can engage with each other and do activities together. That's when we have great access to technology. That's when we have wonderful access to some of those things. What if you don't? Then I'm going to bring us back to the phone pal. Having somebody you can talk to, someone that you plan, by setting a goal. Each week we're going to talk. We're going to, or we're just going to sit together and knit or whatever project we're working on and talk every once in a while. So that is one of the ways in which we can do that. Sometimes we can look at things that Maybe what we want is we're looking at finding ways to bring services into the home. You know, maybe, like Meals on Wheels or home health, just as a way to bring in some more support and some more interaction within the home. Uh, a weighted blanket or something heavy to put on yourself so you feel like you're getting a hug if you happen to live alone, a way of kind of increasing some physical stimulation so that your nerve endings are getting some of that comfort. Weighted blankets are great for reducing anxiety. Um, Practicing gratitude. What are 3 things today that I am grateful for? They don't have to be big things. They don't have to be little things. They can just be items in which, you know, hey, I ate my broccoli today and I liked it. Um, I was able to pet my dog, and I could watch the leaves fall down and enjoy my husband raking them rather than me. Whatever it is you're grateful for, it doesn't matter. It's just being aware of the gratitude that you have. So realized I forgot to show you some more technology things. So we have at our disposal some really interesting ways to be technically engaged with each other. This is called the Grand Pad. It's put out there where it's just a very simple way for people to do FaceTiming or phone calls. Then we have very sophisticated forms of assistance in which they're doing monitoring you for diabetes and blood pressure and or doing pill minders, and then oftentimes they'll have people who call you on a weekly basis or sometimes more depending on what's going on to assist with hey, we're noticing that your blood pressure is up this week. How are you doing? What's going on? Is there anything we need to explore? Those kinds of things. Okay. So um I think what I want to do right now is just maybe take a moment to see if there's any questions, and then I'm going to come back to some information that I have. I see Bill put that some of these might work for youth as well. Definitely, Bill. In fact, a lot of the research I found, um, they talked about emotional intelligence for youth and making sure that we have them working along the ways that help them to be everything they need to be at that moment in time. Um, do you have any suggestions? So Mary is wanting, do you have any suggestions, especially for connecting with teenage grandchildren who live in another state or are online for school or at sport practice a lot? So Mary, it sounds like what you've got going on are some very busy teenagers who you want to reach out and talk to. My one question for you is, where are you technologically wise? I see you have an iPad, which lets me know that you have some technical skills that way. And it's for a teenager, it might just be what you're needing to do as far as connecting that way is just grab a moment here or there. Um, and FaceTiming, they're all very skilled at that. Maybe even telling them, hey, I want to be able to FaceTime with you. Can you show me how to do it if that's not something you know how to do? Um, and then, looking at the process for that in um, connecting with them, kind of finding out where they are with it. Uh, And then Sarah Lee has this great thing about, yes, you're right. There are many things that are streamed online and in that process. Bill, I do see your question about what might be some more engaging questions. When I'm going to do some revisiting of solitude, which will get to some other questions for us to kind of maybe explore in that process. All right. Any other questions right now? Long-term care facilities, I think from the process of what I'm familiar with, and I will let you know right now that this is coming from people who I've talked to, from patients or from long-term care facility providers themselves. One of the things that when I have talked to patients' families, they have been very grateful about how long-term care facilities have been working to try to maintain um, engagement with their within the community itself. I think the most fun one I heard about was exercise bingo, where people were up and down the hallway in their room, and then they would and I can't tell exactly how this worked because I was getting this from somebody else, but they would somehow call something out, and then people would do an exercise stretch of some sort. So with the long-term care facilities, more and more of them are getting face-to-face equipment in there, which is wonderful because I think having that kind of way of being able to meet with your loved one, even when you can't be there yourself, is a wonderful thing to do, particularly when a lot of times when we have individuals who go to long-term care facilities, just because of the nature of our world and how we work with each other distance-wise, because, you know, uh, grandma might live in Mankato, but sons and daughters and grandchildren might be up in the cities. So having that face-to-face activity is something that is really nice for us to be able to have through some of this technology support. Um, I am going to go back to my slide here, presentation, and revisit solitude unless there's another question, but I don't see another one right now. So what I want us to do when we look at this gratitude process, when we look at revisiting solitude, part of the reason that we want to practice solitude is getting to know about ourselves. And part of that process of getting to know about ourselves is asking ourselves questions like, what do you most love doing and how come? What do you most dread doing and how come? How do you respond to distress and what are you most grateful for? Asking yourself these 4 questions can help us to develop an understanding of who we are and how we might want to connect with individuals. Utilizing solitude does not mean we're turning ourselves into monks. We are just giving ourselves time to reflect. It is it's like we're learning our mind. We're allowing our mind to wander. Um, So I think Bill is asking if I can repeat those 4 questions again. What do you love most doing and how come? What do you most dread? How come? How will you how will you respond? I can't talk. How do you respond to distress and what are you most grateful for? Again, this is just to give us a chance to kind of let our mind wander. We're doing this basically without an agenda so that we're able to learn more about our emotions. Notice the senses we're feeling. Um, and that process. So that is kind of what that is at this point. When we look at that, part of this is for us to help us to understand and identify how does our personality fit with others? What is it within ourselves that we want to connect with others? How do we handle conflict with others? Do we have any quirks that really make us, interesting, or do we have quirks that might make it hard for us to be engaged with others? Part of reducing loneliness is looking at ourselves honestly. So I'm going back to that, when someone offers you to help, do we invite assistance? Do we invite people into our lives? Do we, or do we wait to be invited? Typically, we want to look at how can we invite people in, let go of any shame or embarrassment that could stop us from inviting others in or reaching out. The process of reducing that isolation is to know yourself so that we can do that in a different way. And one of the ways we can do that is through practicing compassion, the compassion of self. Oftentimes, one of the first things that I work on with people when they have thoughts that are not helpful, I will ask them to rephrase their thought process into what they think they would tell a friend. Because a lot of times we're a lot meaner to ourselves than we would ever be to anybody outside of ourselves. And it's really an interesting process what happens in those moments. There is a softening, there is a kindness, there's encouragement, all of the things you would want to give to a friend. You are then creating the habit of giving it to yourself. So if you have the thought of, I can't do it, what would you tell a friend? Typically, you'll tell them, I know you can do this. This might be hard, but I know you can do it because you'll work hard at doing it. So, how do we practice self compassion for ourselves? So, we can start this by just doing, whoops, just doing a meditation. And in this meditation, what we want to do, because sometimes this can be hard to say to ourselves, imagine a friend saying this to you. So I want you just wherever you are, just take some breaths, settle in comfortably, and imagine a friend telling you, may you be safe and protected. May you be peaceful and well. And just hear that friend telling that to you over and over again. May you be safe and protected. May you be peaceful and well. May you be safe and protected. May you be peaceful and well. Next, what I want you to do is imagining saying that to yourself. May I be safe and protected. May I be peaceful and well. It's these moments of pausing that are life filling. When our heart pumps, it is the pause that gives us life. Because when our heart pauses, it fills with blood, and then that blood is squeezed out and pushed to the rest of our body. So when we take those moments to pause, we're giving ourselves moments to be fulfilled so that we can push it out to others. So please pause, slow down, and connect. Thank you. Are there any questions?
Well, hearing none, and I can't get my PowerPoint pulled up, so I apologize. I want to thank you so much, Anita, for the good information that you shared with us today. It was amazing. And we do have to stop and take care of ourselves and do whatever we can to go get through this social isolation.
Mhm.
So I guess that will be the conclusion of our presentation today. Again, thank you, Anita, and thank you, Catherine, for partnering with us to make this presentation happen today. Thanks, everybody, for joining us, and I hope you enjoyed the presentation. If you have any questions and want to reach out to one of us, please feel free to do that. And I want to encourage you to visit the Mayo Clinic Health System website for resources. And you can see a couple of the COVID resource websites on your screen now. Thanks to Jason getting that up for me. And then when you are visiting our website, remember to click the classes and events page for upcoming webinars and events, because there's a lot out there for you to enjoy and to engage in. So again, thank you, everybody, and you have a wonderful day.